So I'm a professor of psychiatry. My clinical work focuses on psychotic disorders like schizophrenia and its symptoms like auditory hallucinations or hearing voices and delusions. But my academic work through the years has really more focused on what I call the gray area between psychopathology and normal behavior. And my most interesting topic within that gray area are delusion-like beliefs, beliefs that resemble delusions, but don't quite rise to that level. And right now, we have no better example of that than conspiracy theories. Now, historically, conspiracy theories have been sort of at the fringe and perhaps a subject of some humor. But I think things have gotten quite a bit more serious in the past year or so with the global pandemic. The World Health Organization warned us over a year ago that we would be seeing the coming of an infodemic, that is a pandemic of misinformation related to COVID-19. But I don't think any of us really predicted just how big of a wave of misinformation there would be. And so we've really seen conspiracy theories evolve in real time over the past year or so, particularly around COVID-19. And we've also seen them merge and coalesce with other types of longstanding conspiracy theory themes, like technology or related to vaccines, or even with QAnon. And so we've all heard recently conspiracy theories that COVID-19 is a man-made bioweapon. We've heard that, at least here in the US, that COVID-19 was manufactured by the so-called deep state as a plot to make President Trump lose the election. Some people have claimed that COVID-19 isn't caused by a virus at all, but that it's caused by 5G networks. We've heard conspiracy theories that COVID is a plot orchestrated by Bill Gates to implant microchips into people for the purposes of tracking. And finally, this one has reared its head again recently. We've heard that COVID-19s are part of a plan to cause mass sterilization and population control. Now, we've also seen QAnon. QAnon was born here in the US out of the so-called Pizzagate conspiracy theory a couple of years ago, but it's really spread beyond the US and become a sort of part of a larger populist revolt against so-called elites and experts. And so QAnon now is a worldwide phenomenon. Now, why do we care about conspiracy theories? We care because, as I like to say, belief in misinformation always has the potential for dangerousness. So as a physician, when I think about COVID-19 related conspiracy theories, we know that belief in conspiracy theories is associated with rejecting basic medical recommendations or advice. In the context of COVID-19, that might be associated with wearing masks or social distancing, or of course, vaccination. And there are, of course, while rare, there are examples of conspiracy theories inspiring violent behavior. So again, with regard to Pizzagate, I think everyone knows that story around the world. The gentleman who was planning to, quote, self-investigate went into a pizzeria with a semi-automatic weapon to uncover a child pornography ring, which was not a reality. In the UK last year, from the spring through the summer, people were setting 5G cell phones towers on fire. And then, of course, here in the US, we had the somewhat unprecedented storming of the US Capitol earlier in January based on conspiracy theory beliefs. So I want to now talk about conspiracy theories and what their causes are. And I'll start by defining conspiracy theories. I like to say that conspiracy theories reject authoritative accounts of reality in favor of some plot involving a group of people with malevolent intent that's deliberately kept secret from the public. And surveys have consistently shown that about half of the US population believes in at least one conspiracy theory. And this is not just a case of sort of reverse American exceptionalism. Surveys across the world have shown similar rates, where generally about half the population worldwide believes in at least one conspiracy theory. Now, as a psychiatrist who talks about this subject, the two most common questions I get, or I should say the most common question I get, is how can it be that seemingly normal people, about 50% of the population, can believe such weird and false things? And there has been a lot of research around conspiracy theories over the past decade, and it's certainly a hot topic now. And I'll just summarize it quickly by saying that there are a number of what I call cognitive quirks that are associated with belief in conspiracy theories. And those include things like needs for closure, certainty, or control, need for uniqueness, this idea that people who believe conspiracy theories are onto some secret knowledge that the rest of us are not aware of. There's also associational correlations with lack of education or lack of analytical thinking, also a psychological construct called bullshit receptivity. And of course, there are some political trends, particularly right now, where right-wing politics seems to be a little bit more associated with conspiracy theories, though that historically hasn't always been the case. The second question that I get most frequently about conspiracy theories is basically, are people crazy? Is this a evidence of mental illness? And my belief is that that's not really the best way to understand conspiracy theories. Again, we have 50% of the population believing in at least one conspiracy theory, and we don't think that 50% of the population has a psychotic disorder. Also, the cognitive quirks that I mentioned that are associated with belief in conspiracy theory, these are quantitative differences. So in other words, people have more needs for closure than, say, people who don't believe in conspiracy theories. It's not an all or none or black and white phenomenon where these traits are only present in people that believe conspiracy theories. So I think it's more accurate to say that belief in conspiracy theories is less a symptom of mental illness and less a symptom of mentally ill individuals, as it is a symptom of a sick society. So I think we need an explanation that understands and explains conspiracy theories from a social perspective, as well as one from information science. And so the way I like to explain conspiracy theories is that they're really born out of two main components. And those components are mistrust and misinformation. So I'll talk a little bit about mistrust first. When I talk about mistrust, I'm specifically talking about what in academia we call epistemic mistrust, which simply means mistrust in information and mistrust in authoritative sources of information. And that comes in a variety of different flavors, if you will. Mistrust can be part of paranoia, and it can be on the more pathological end of the spectrum. But mistrust can also be rooted in racism. There's some of the connection to civil rights. There are long-standing conspiracy theories that are rooted in anti-Semitic beliefs, for example. Mistrust can also be related to politics in potentially a negative way. So, for example, the lab leak conspiracy theory is really potentially a way to avoid taking blame within one's country and projecting that blame onto China. So conspiracy theories clearly can be used strategically by politicians and governments. And finally, mistrust can also be due to bona fide trust violations. And certainly here in the US, there's a long history of civil rights violations, particularly within the African-American community. And that has bred a long history of mistrust in institutions of authority, including the institution of medicine. So vaccine hesitancy related to belief in conspiracy theories is well known to be prominent in some disenfranchised communities. I think also when we're talking specifically about science beliefs, there's a lot of mistrust in science and scientists more specifically, because in part people don't really understand that science is really an iterative process. We're constantly coming up with new data and changing what we say. And in medicine, one year we're saying hormone replacement therapy is very effective. The next year people are saying, well, maybe it's not so effective. And I think that oftentimes the public comes away with that back and forth with a sense that we don't know what we're talking about. And not understanding that that's really what I call the superpower of science, the idea that you can actually change the core belief based on the data rather than the other way around, trying to fit the data to the belief. And so during COVID-19, I think we've seen a couple missteps taken by institutions of authority that have really created a spark to allow conspiracy theories to flourish. So when the World Health Organization and then the CDC here in the US at the beginning of the pandemic initially talked about that people should not be wearing masks. So then later, when they said they should wear masks, the public really didn't know whether or not to trust that. There was initial information from these institutions of authority suggesting that the SARS-CoV-2 virus could not be transmitted through airborne mechanisms. That was also revised. And even recently, there was a leaked CDC document that about a month ago that revealed that there were a small number, but a non-significant number of breakthrough infections among vaccinated people. And that really was not something that was shared with the public initially. And so I'll get back to this, but these are missteps that institutions of authority can take that really mean that they have to own that mistrust. All right, so part two, in terms of what causes conspiracy theories, is misinformation. And my idea here basically is that if you mistrust institutions of authority, then you are vulnerable to misinformation as well as deliberate disinformation. And I should say that I don't really like the term conspiracy theorist, because that suggests that people are hypothesizing and theorizing and testing their theories. And I don't think in the vast majority of cases that's what's happening. I think by and large, what people are doing is they're searching for answers because they don't trust. They search for answers. And in this day and age, we're really talking about searching online. And there's that phrase, do your own research, which I kind of hate, because I think that that process of looking for information online is not true research. And what often happens is people fall down these rabbit holes. I think confirmation bias is a household word now. That basically means that particularly when we search for information online, we're clicking on information that reinforces what we already believe, and we swipe past information that disagrees with what we believe. And so increasingly now, when we talk about conspiracy theories, people talk about focusing less on the problem of misinformation in the head and more on the problem of misinformation in the world. And in terms of the technological aspect here, we've really seen over the past couple decades, and especially with the internet, a kind of democratization of knowledge. We now have so many different sources of information readily available to us online in a way that's completely different from when I grew up as a child. And so now we have information, misinformation, and deliberate disinformation all right next to each other in online spaces. And for the most part, none of us have really been ever taught how to sift through that information to find information that's reliable. And then when we add in features of digital architecture like filter bubbles and echo chambers, this really creates what I call confirmation bias on steroids. When we're doing research, quote unquote, online, what we're really doing is just reinforcing our beliefs. Now, I also want to say that part of the reason misinformation and disinformation is so ubiquitous these days is that disinformation is a massive for-profit industry. We know from information science research that online misinformation travels faster and farther than reliable facts, which is not surprising, right? It's really that they're more interesting than boring old facts. But because of that, misinformation is often used for financial profit, either by selling misinformation itself or by piggybacking onto it. And so, for example, not to pick on Gwyneth Paltrow too much, but Gwyneth Paltrow, as well as Alex Jones, who runs InfoWars, I think that's probably known internationally, they use different kinds of disinformation to sell what are essentially the same nutritional supplements, which is kind of an interesting twist on the disinformation story. There's also automated bots. They're basically computer programs that use disinformation as a way of clickbait to spread malware, for example. So this illustrates how lucrative disinformation can be. And I also mentioned that conspiracy theories are often used in politics. And so we have political leaders who use conspiracy theories to displace blame, to incite mobs around the world. We know that Russia has a massive disinformation campaign, but we also know that quite a few other countries, numbering in the 70 different countries, have disinformation campaigns as well. And that's certainly true here in the United States. And so it's been argued that by design, we're now living in a post-truth world where people can't agree on basic facts and what constitutes evidence anymore. The political philosopher Hannah Arendt talked about how undermining the very belief in the concept of truth results in a populace that's easily manipulated. And I think we're seeing some evidence of that now. I also like to say that the real conspiracy theory, I like to say that the irony of conspiracy theories is that people don't see the real conspiracy theory, which is that there are often people who are profiting off conspiracy theories themselves. And these people are creating conspiracies and dispersing them. And so finally, in the next couple of minutes to close, just want to say a couple words about what I think needs to be done if we're to regain the concept of truth and get away from such widespread belief in conspiracy theories. And according to my model, that really rests, number one, on trying to restore trust. And I think the key to restoring trust is one-to-one engagement. So as a physician, if I'm talking about medical related conspiracy theories, it's really about having one-to-one conversations with my patients. I think when we talk about institutions of authority, they need to understand that trustworthiness comes before trust. Institutions of authority have to build trust within communities through kind of grassroots outreach campaigns. Public engagement also has to occur with transparency. Institutions of authority need to let the public in the door and give them a seat at the table, as it were. And finally, with regard to correcting misinformation, it's really necessary to counter misinformation where it occurs. And so I think it's important for scientists, for government officials to have an online presence because so much information occurs online. And we also know that probably the most evidence-based strategy to counter misinformation are inoculation strategies. That is beating misinformation to the punch by warning people, hey, you're going to be hearing these false things, and so watch out for them. And finally, I think science education is very important. I think some conspiracy theories are relatively innocuous, but some of the ones that are more dangerous are beliefs that are refuting what scientists tell us. And I think we really have to promote science education in a more serious way from a very young age. And we have to teach analytical thinking, and we need to teach people how to sift through online information to find facts rather than misinformation. And of course, the big challenge for the next several years is how to balance free speech and democratize information with restricting the ubiquity of misinformation and trying to limit its harmful effects. And certainly, I think we'll see more conversations about that in the years to come.